Good evening, everyone, and welcome to our expert panelist discussion this evening. I want to thank everyone who has participated in this hangar incident. I know it's been quite a wild ride for the last 2 months, and we hope tonight that will provide more information and understanding of the data that has been collected to date and a better understanding of basic recommendations people in the community can follow. Tonight, actually, sorry, I forgot to introduce myself. My name is Dr. Regina Chencio Kwong, or I go by Dr. CK. I'm the County Health Officer for Orange County Healthcare Agency, and I'll be the moderator for tonight's panel discussion. We have many different experts that we will come together to talk about this important topic, from environmental health, occupational health, and toxicology, and many of them have public health backgrounds or emergency response backgrounds. Again, I want to also thank the city and all the first responders who have been working around the clock to really make sure the community has been safe during this incident. Special thanks to the fire department, Tustin PD, City of Tustin officials, county officials, South Coast AQMD, EPA, and the contracted providers for the city, the county, and the Navy. The hangars in Tustin are historical monuments. Both were built during World War II era and are featured in many different movies. And many who grew up in Orange County just remember these iconic structures. So it was really a tremendous loss when we lost North Hangar earlier in November. Our main focus tonight is to discuss on the incident, how the findings from the data collected led up to the current recommendations that were recently published in recent weeks. And it is my hope, again, that through this discussion, we learn and hear directly from the experts who have been studying the different components that were evaluated for this specific incident. So let me start with the introductions of each of the panelists. Today we have Ben Castellana from U.S. Environmental Protection Agency, or U.S. EPA. He's an on-scene coordinator for the U.S. EPA Region 9 Superfund Division, Emergency Response Planning and Preparedness Branch. He has a PhD in geology and geochemistry from UCLA and has over 26 years of experience working in environmental emergency and disaster responses across Region 9, and that includes California, Nevada, Arizona, and Hawaii, and the greater USA. He's worked on multiple emergency major response events, including Katrina, the Refugio oil spill, Huntington Beach oil spill, and numerous California wildfire responses. Welcome, Ben, and thank you for joining us. You want to say hi to the participants and listeners?
Hi, thank you.
Then we have Eileen Mananian. She is a unit chief in the Site Mitigation Restoration Program at the Department of Toxic Substances Control, otherwise known as California DTSC. Her group oversees investigation and remediation of hazardous waste at military facilities in Southern California. She has 17 years of experience in environmental and regulatory field and holds a master's degree in environmental and occupational health. Welcome, Eileen, and thank you again for joining us. You just wave your hand there. Next, we have Dr. Andrea Polidori from South Coast AQMD. Hopefully I said that right. He has been with South Coast AQMD since 2009 and currently leads the development and implementation of several innovative air monitoring and community programs. He graduated with a PhD in atmospheric science from Rutgers University, and prior to joining South Coast AQMD, he was a research assistant professor in the environmental engineering department at the University of Southern California. Welcome.
Thank you very much.
Next, we have Dr. Chris Coleman. Dr. Chris Coleman is a board-certified toxicologist and industrial hygienist with the Center for Toxicology and Environmental Health, or CTEH. He has experience in providing toxicology support in emergency responses across the country. His firm has been supporting some of the air monitoring and sampling operations in response to this hangar fire. Welcome, Dr. Coleman.
Thanks, Dr. CK. Good evening, everybody.
Next, we have Dr. Arthur Frank from Drexel Program in Public Health. Dr. Arthur Frank is a professor of public health and professor of medicine at Drexel University in Philadelphia. He comes all the way from the East Coast. Really want to thank him for joining us this evening. He's trained in both internal medicine and occupational and environmental medicine, and he has been an academic physician his whole career. He has a PhD degree regarding and has been studying asbestos and the diseases it can cause for over 50 years. So it's really great to have you here on this call, Dr. Frank. Next, we have Dr. June Wu, who is a professor in the Department of Environmental and Occupational Health at UCI, program in public health. She has over 20 years of expertise in environmental health research. She focuses on human exposure assessment, environmental epidemiology, and has published over 120 peer-reviewed papers. She examines the impacts of environmental exposures on various health outcomes, focusing on maternal and children's health. She works closely with local community partners on multiple environmental disparity issues related to air pollution, lead contamination, and climate change. Welcome, Dr. Wu. And next we have Dr. Oladeli Ogunseitan, and I'm so sorry if I butchered that. Or we're going to call him Dr. Deli for ease tonight. He holds a title as Distinguished Professor at the University of California, Irvine. He led the establishment of the program in public health and served as the founding chair of the Department of Population and Health and Disease Prevention. He also served on the state of California's Green Ribbon Science Panel and the state's Advisory Committee for Community Protection and Hazardous Waste Reduction initiative of the Department of Toxic Substances Control, or DTSC. And from 2021 to 2023, he served on the City of Irvine's Green Ribbon Environmental Committee.
Thank you, Dr. CK.
Thank you. And so before we talk about the incident, I know that I want to give time for all of the different panelists to mention any disclosures they have. I have no disclosures. I'm the county health officer trying to moderate this talk to really hear again from the experts so that the community can also hear directly from the experts.
Yeah, thank you. Good evening, everyone. I've been at UC Irvine for more than 30 years, and I've lived in Irvine for that period of time. And we have Dr. June Wu from UCI also here. And we just want to note that we are experts in our own right, but we're not speaking for the university. We do work there. So thank you for the opportunity to be part of this panel.
And similarly, while I'm a professor at Drexel for more than 20 years, I'm here by individual capacity, sharing my thoughts, and good evening to everyone.
Good evening, and thank you again. And again, want to thank everybody who's really responded to this incident. I know it's been a huge lift in the county as well as the district offices. Supervisor or Chairman Wagner and Supervisor Sarmiento, as well as the city of Tustin, have been really supportive and again trying to get this off the ground and really try to respond to the incident for the community. So we're going to go on to a PowerPoint to help lead us in this discussion. And just know that there's a lot of information on the Tustin website, Tustin.ca. Well, I'm going to probably get this wrong, tustinca.gov, I believe. We have a lot of handouts that are available on that website, or sorry, tustinca.org. And when you go on Tustin's website, if you click on Tustin North Hangar Fire Resources, it will provide you a lot of information about this specific incident. And in that, you'll also see some flyers. So I'm going to have the team put the PowerPoint up. I'm not sure if I see the PowerPoint yet. Okay, as we wait for the PowerPoint to show up, I just want to point out on tustinca.org, when you click on that link of resources, You'll find daily incident reports as well as incident FAQs. And on the front page, there are two helpful tip guides. There's a health and safety tip handout as well as an incident phase community guide. So initially, just to talk as we were still waiting for this PowerPoint to come up, on November 7th, unfortunately, the fire erupted at the North Hangar in Tustin. And for about 24 days until December 1st, what we'll call that incident, that portion of the phase as a fire response phase. That was November 7th through December 1st, 2023. And during this phase, there was a lot of activity, including many organizations that came together to really try to address the fire, also do air monitoring and further understand what was in the debris. And also there were many efforts to address the community that also had visible debris in their community settings. From the fire response phase and the conclusion of the fire response phase, we went into what we call a debris stabilization phase. And this is where there was a specific component that was applied to the site to help stabilize the remaining debris at the North Hangar site. Also, during this phase, multiple structures were removed. That includes the doors, as well as the other structures on the concrete pillars that remain standing. Currently, we're in what we call the maintain stabilization phase, meaning there's ongoing community monitoring during this phase. And, with the monitoring, if there's any shifts or if there's any concerns, more stabilization material will be applied to the debris that remains. And finally, the last phase of this ongoing incident will be remediation, or the removal of the remaining debris from the site and from the county, and that's a future phase. Next slide. So we're going to go over the initial emergency response and the initial testing, as well as the testing that continues to occur today. So I'm going to hand it off to Dr. Andrea Polidori to discuss South Coast AQMD's response to the initial phase.
Yes, thank you, Dr. CK. On November 7th, when the fire broke out, our staff, South Coast AQMD staff, was immediately sent on site to evaluate the situation and assess potential air quality issues that might result from the hangar fire. Our monitoring staff were at the scene of the incident at around 1 p.m. on November 7th, and they used a state-of-the-art mobile monitoring platform to take measurements of air toxic metals, including lead and arsenic. These mobile monitoring measurements were taken on public roads in the community surrounding the hangar. In total, mobile monitoring was conducted from November 7th to November 12th, during which time we also collected bulk samples of debris, fallout material, and gases and particle samples at multiple locations near the hangar and in nearby communities. The samples were analyzed to determine the presence of asbestos in fallout debris and in suspended particles, and of benzene and other gaseous pollutants in the air. I would like to point out that all samples our staff collected were analyzed in record time, and their results were made available to the community and to local authorities either the same day or within 1-2 days after collections. Following these initial monitoring activities, the US EPA expanded the number of air monitoring sites near and around the hangar. And this concludes my quick summary, and thank you very much again.
Thank you. And then we'll hand it off to Dr. Castellano to discuss EPA's role in the initial phases.
Sure, thank you. So AQMD reached out to US EPA on the afternoon of the 7th, and we started discussing how US EPA could best assist the responding agencies with the response. And the first ask was to basically try to get more monitoring equipment on the site, try to get more monitoring locations, and start air sampling as well for asbestos and metals. So we identified 4 locations that were secure, had 24-hour access, and we set up 4 stations for monitoring particulates and sampling for asbestos and for metals. Our methodologies were a little rough getting started, so our metals analyses had fairly high detection ranges, and we had to change our methodology a little bit midstream. So with those 4, the intention was to try to expand further, and we started reaching out to try to bring more pieces of equipment onto the site and more individuals. We had conversations with both the Navy and the city of Tustin, as well as our internal EPA folks across the country, to try to see how many pieces of equipment, how many monitoring stations we could stand up in as short a period of time as possible. And so it was basically a race between EPA, the Navy's contractors, the city of Tustin's contractors to get teams and monitoring equipment into the field. On the night of the November the 12th, which was that Sunday night when the fire erupted again, we went from a static situation to a dynamic situation, and we felt much more urgency to get monitoring stations around the fire as well as around the perimeter of the site, and more monitoring stations in the community. By the end of the week, we were up to 33 stations. We wound up having to come down to 32 stations where we were doing sampling and monitoring, just simply because we had some stuff disappear out of the field, which happens in responses a lot. And so these data the monitoring data have been reported on a regular basis daily. The sampling data, because they go to a laboratory and there's a longer turnaround time, it's taken a little bit longer to get those data up on the website, but they are there now. And finally, the last step was that we would hand all of the EPA equipment, all the EPA sampling eventually transitioned over to City of Tustin and U.S. Navy contractors.
Thank
And
you
that's
so
where
much.
it is now. Thank you.
Thank you. And we'll proceed to the next slide. So there were a lot of questions early on about, I know you all mentioned about air types of monitoring. And I know that there's many different websites that tell us about air quality index as well as air monitoring and in this specific case, that are not usually monitored for air quality index for just regular pollutants. I'm going to turn it over to Dr. Coleman to help us understand what air quality index is, compared to all the different air monitoring that has been performed.
Yeah, sure. Thanks, Dr. CK, and good evening, everybody. We can go ahead and go to the next slide. So I appreciate the opportunity to speak to you all tonight about the extensive air quality testing that has been coordinated by the agency supporting the Hangar fire response efforts and the air monitoring and testing that continues to be done today. Specifically, in these slides, I'll be summarizing air testing that has been performed for airborne asbestos, metals, volatile organic compounds, and particulate matter. And like Dr. Cassiano with the EPA said, this has been done at more than 30 locations around the hangar and in the surrounding community. So starting on this slide with asbestos, there have been no detections of asbestos in the air. More than 900 24-hour samples have been collected and analyzed at the hangar site and in the surrounding community, with no asbestos detected in any of these samples. This is really reassuring, considering that the air is the most important route of exposure for asbestos compared to asbestos that could be embedded in solid materials and debris. Next slide, please. And regarding metals, hundreds of 24-hour samples have been collected for analysis of airborne metals, and the large majority of these air sampling results were also non-detect. And on the day of the fire, as Dr. Polidori mentioned, South Coast Air Quality Management District detected lead and arsenic in the area of the smoke plume. The Navy, EPA, and response contractors then collected, and were continuing to collect, air samples daily at locations around the hangar site. And among the hundreds of samples collected and analyzed, there were intermittent detections of aluminum, antimony, barium, lead, manganese, and zinc. Although, as I said before, the majority of the results for these metals were non-detect. Next slide, please. This slide focuses specifically on the testing for lead that was performed. Of the more than 700 samples that were collected for lead in the air, there were 10 detections. 6 of these 10 detections were observed at the air testing station positioned closest to the hangar. The table shown here illustrates when these detections were observed and what the concentrations were. It's important to note that there have been no detections of lead in air samples collected after November 20th. Next slide, please. Monitoring and sampling for what are called volatile organic compounds was also performed. Just so you know, the term volatile organic compounds, or VOCs, it refers to many substances that can easily become a gas at room temperature. We encounter VOCs every day since they're present and can be detected in common household items like paints, cleaning products, fuels, and certain furniture materials. And on November 7th, South Coast Air Quality Management District collected air samples for analysis of VOCs downwind at the hangar site. They noted that these results of this testing for VOCs were within typical background levels of VOCs in our environment. City of Tustin contractors also performed additional monitoring for VOCs around the hangar site, and they recorded 7 intermittent detections of VOCs that were also within common background levels. Further testing has not detected VOCs since November 15th, after more than 2,000 readings have been taken. Next slide, please. And lastly, I'll spend a moment discussing airborne particulate matter. So similar to how VOCs can represent a mixture of airborne gases, particulate matter is a mix of various particles made up of dust, dirt, smoke, and small droplets of liquids. There are many everyday sources of particulate matter in our environment, including cars, factories, fires, and even natural suspension of dust and pollen by winds is considered particulate matter. During the initial days of the fire, South Coast Air Quality Management District monitored particulate matter as part of their mobile monitoring platform. And as Dr. Castellano mentioned, EPA and response contractors later set up particulate matter monitoring stations at dozens of locations around the perimeter of the hangar and in the surrounding community. Next slide, please. So the average particulate matter readings recorded at these monitoring stations have been between 1 microgram per meters cubed and 92 micrograms per meters cubed, which according to what's called the Air Quality Index scale, indicates good to moderate air quality. Now, Air Quality Index, or sometimes abbreviated AQI, this information is reported across the state of California each day, and good to moderate AQI is consistent with the background level seen in Tustin area prior to the fire. And as shown in the table on the bottom left of this slide, the majority of air monitoring for particulate matter at the stations I mentioned indicated that the levels would be classified in the good or satisfactory air quality index. Readings that were recorded that would be considered in the moderate or acceptable, which is the yellow category, were observed on November 15th, 18th, 27th, and on December 4th, 5th, and 13th. And one thing I'd like to point out here is that the air quality index ratings reported across all of Orange County have actually been in this moderate acceptable range over the past couple of days. And you can look that up online if you search for air quality index. And that's it. Thanks, Dr. CK.
Thank you so much for that. So thank you so much for reviewing all the data, because I know that when we look on the website, there's just so much to access. And I'm hoping this provides a little bit more clarity of what the results have really shown. So next up, we're going to speak with the different experts. I'm going to talk about some other testing that happened in the different facilities. So aside from all of those testing that were performed, certain facilities did have contracted providers to review and evaluate air, as well as microvac sampling to ensure that there was no asbestos. And the Sheriff's Center, Animal Care Shelter, as well as the fire department and local schools and the Columbus Square Community Center were all tested. And all of those areas that are listed here are within less than half a mile from the burn site. And luckily, the good news with all of those sites is that their testing that was performed was all negative for asbestos. 'Cause I know that asbestos is one of the biggest concerns everybody had. Our Orange County Healthcare Agency does have a lead unit here. And we do that on behalf of the state for our lead program. So because we had the tools to test, we did actually do some testing in the soil and the dust at the elementary Legacy Academy, as well as the Sheriff's Training Academy, Montgomery Park, which is in the community in Columbus Square, and OCU Rescue Mission. Again, all of these areas are within less than half a mile from the burn site. And in those test results, what we found was that all results were much lower than the threshold measurements for DTSC as well as Title 17. All of these are reassuring, but again, they were performed early on November 9th and 10th. Next slide. So I'm going to go on to the different experts. We have Dr. Arthur Frank, who has studied asbestos and occupational exposure for over 50 years. So Dr. Frank, with all of your expertise in asbestos, please help us understand, now that we've reviewed some of the results, what does this all mean?
Yes. Well, thank you, Dr. CK, and again, good evening, everyone. When people hear the word asbestos, I think they're entitled to have a legitimate concern, because this is indeed a potentially hazardous material. I've been studying it for more than 50 years, looking at its effects on cells, on whole animals, on patients that I've seen, and doing epidemiological studies. I've worked on multiple continents and have over 100 papers on the subject of asbestos and the diseases that it can cause. Also, the word asbestos really refers to two families of naturally occurring mineral fibers. One group, called the amphiboles, has 5 such mineral fibers, but 90 to 95% of asbestos as used in the United States is not of the amphibole type, but of the chrysotile variety, which is also called the serpentine variety, or white asbestos. The important thing about these 6 fibers that make up the word asbestos is that they can all cause the diseases that we associate with exposure to asbestos. Having said that, I think we need to put into context what is the real risk from the situation that has occurred following the fire at the hangars. In the year 1543, a scientist of that era, a fellow named Paracelsus, put out into the world our basic understanding of the field of toxicology. He said, "The dose makes the poison." And what does that really mean? That depending on how much exposure you get, you have a certain amount of risk. We call this the dose-response relationship. As the dose goes up, the likelihood of getting a disease goes up. Almost everything in medicine can be explained that way. For example, it's flu season right now. If somebody coughs on you once, maybe you'll get the flu. If they cough on you 5 times and you get more viruses, you're more likely to get it. And this applies to everything. Now, because asbestos is both a naturally occurring mineral, and in the past, literally billions of tons of it has been used, asbestos is everywhere. There's no place on this earth that you can't find asbestos and that you won't find it in the air. For example, scientists have shown that at the polar ice caps, you can drill down and you can find asbestos. If we could have the next slide. You can find asbestos and its increasing use over time, especially in the 20th century. And it can be found in many places, but everyone should understand that everyone in the public, in the general public, has asbestos in the air that they breathe. And in a lifetime, a 70-year lifetime, any individual might take in some 3 to 4 million fibers of asbestos. No one has ever shown that this level of disease at this level of exposure has caused any disease. This is a level that we consider background, and with the testing that you've heard about, there's no additional fibers or no excess of fibers. Now, even if there was some elevated amount, which must have been quite small as measured with all of these literally hundreds and hundreds of tests, if there would ever be any risk to individual, that risk would be so small as to be unmeasurable in a population. You would need to measure millions and millions and millions of people to find any change, which is extraordinarily unlikely to occur. Another concern I know is that their debris at the site still has asbestos in it. That is really no longer a threat to the community since it has been covered. It is encased, and my understanding is that it will be cleaned up appropriately and not in the future put the community at risk. There are ways to clean that up that is not hazardous to anyone in the community away from the site, and the workers, of course, would be protected. Some of the questions that I understand have been raised about this is, as I've just said, yes, there's an expected background level. It is this level that has not been shown to cause disease. People have been concerned if they have plants or parts of their gardens, could they use those items, the vegetables they might be growing? Any fibers that might be there, and again, there's no evidence that there is, could simply be washed off. And in terms of the air handling systems that people have at home, again, the finding of a single fiber or an odd fiber here or there is not at all unexpected, given that literally every place in the world has some background level of asbestos. But what I find encouraging, and I'm someone who has made a career of studying people, not with this level of exposure, but with higher levels, but varying amounts of exposure, is that I would not be concerned that with the data that we have, that there's going to be any risk to folks in the community. So thank you for the opportunity of sharing those thoughts with you.
Thank you so much. And I'll probably ask you a little bit more when we look at the community recommendations later on, but really thank you for that context. Here we have an image that I was able to pull out from a different public health handout. And I felt like this might be helpful in relaying to the community what is an example of very low risk exposure to very high risk exposure. And again, what you're telling me from your experience is really the occupational, and at least what I've read, it's mostly the occupational exposure that really puts people at risk.
I have seen thousands and thousands of people over the years with both exposure, and have read files on thousands of people with disease. And it is people with high levels of exposure that primarily get disease. There is little, in fact, no evidence that these background levels where it says very low risk has led to people developing disease. Some homes were built with asbestos in them. That too has rarely put people at risk, and it's only when they've manipulated it or replaced it. Again, home renovations puts people at greater risk, but the vast majority of disease has been among construction workers, shipyard workers, places where literally tons and tons of asbestos-containing materials have been used.
And I know that in the first week of the incident, there are individuals, especially in the community, who maybe they were on site because they wanted to watch the hangar burn and take some images, or maybe they were in the surrounding community and they didn't see all the recommendations, and maybe they touched some of the debris and immediately put that in the trash. Would you consider that more of a low risk exposure if they handled it?
It would be a very low risk of exposure, sort of a one-time handling of some debris that probably was mostly something else other than asbestos. Even if there were a few extra fibers that they breathed. Again, I'm not going to say the risk over a lifetime is zero, but I'm going to say the risk is so low that it would be scientifically unmeasurable, and it's not something that folks ought to be concerned about. I've dealt with situations where people have had short-term exposures, and I think there are appropriate occasions to reassure people that the risk of getting disease is extraordinarily low.
Thank you so much. Next, let's talk about lead. I know that, so our original concern was asbestos, because we knew that there was asbestos in some of the bulk debris that was initially tested. The next item that was tested in the initial smoke plume, was lead. And I know that our environmental team did some of the testing in the local areas, but we're going to hear from Dr. June Wu, who has been studying lead here in the community, about, her take on this, previous studies that were done in a local community, and insights she can provide.
Thank you, Dr. CK. Good evening, everyone, for joining this discussion. My research focuses on the impact of air pollution and lead contamination on human population. And I'd like to briefly discuss what it means for having lead in the soil and how to deal with it. First, I want to talk a little bit about lead concentration in the soil. Lead is a naturally occurring element in all soils. So it generally occurs in the range of 15 to 40 parts per million in soil as its background concentrations. So even though lead has been banned and removed from multiple sources decades ago, deposits from leaded gasoline, lead-based paint, and industrial sources have contributed to the elevated levels of lead in the soil even nowadays. This is because lead is an inert metal, thus it can stay there in the soil for many hundreds of years if it's not been disturbed. So this map here shows you soil lead concentrations based on over 1,500 samples collected back in 2018 by the iProno Santa Ana or Lead-Free Santa Ana collaborative team for every census tract in Santa Ana. First, I want to point your attention to the samples we collected in relatively pristine areas or the control areas at 8 locations where there was no apparent source of lead contamination. So those are the big dots you see in the Crystal Cove State Park and the Santiago Oaks Park. As you can see, the concentrations of lead in these relatively clean soil samples were around 20 to 40 parts per million, which reflect the background concentrations. Then go to Santa Ana. As you can see, the concentrations of lead ranged from 11 parts per million to more than 140 parts per million in Santa Ana. And the hotspots areas reflect the long-lasting influence of historical traffic and older house emissions. And at one site, we have the highest concentration of soil lead, over 2,500 parts per million in the residential location. And another site, over 1,400 parts per million at a near roadway site. So which populations are mostly affected by lead contamination? Lead can basically affect everyone, but the population that are mostly affected is children, because lead mostly affects brain and the neural system, and children's brain is still developing, thus is more vulnerable. Children play with dirt and have more hand-to-mouth activities, which increase their exposure to lead. And also, given the same exposure levels externally, children have a higher rate of lead absorption than adults. For instance, adults typically absorb up to 20% of ingested lead, while children absorb about 50% of ingested lead. So the common pathway for the exposure of children are through ingestion, as they have a lot of hand-to-mouth activities. And for the general population, ingestion and inhalation are both primary route for exposure. So people may ask about, if I'm exposed, is there anything we can do to counter the exposures? So there are numerous studies found that certain conditions, for instance, if you have an empty stomach, if you're on fat diet, and especially for people who have deficiency in iron and calcium, then a lead absorption rate is higher. Therefore, to reduce the lead in the blood, if you don't have an empty stomach and you are not deficient in iron and calcium, and also not on fat diet, those procedures, more of a dietary cautionary approach, would reduce the lead exposure internally. And then there are also questions if I plant vegetables in the soil contaminated by lead, and would it still be okay for me to eat the vegetables? A common assumption is that soil contamination with lead is unsafe for gardening. However, studies have found that plant uptake of lead is typically low in most plants. The risk from most plant uptake of lead is low. The main concern, rather, is ingestion of soil that contaminated the food, not the food itself. But there are some exceptions. The exceptions are root vegetables, such as carrots, turnips, radishes, and beets. Most lead is absorbed from soil in these root vegetables. However, there doesn't appear to be a proportional relationship between the amount of lead in the soil and how much actually getting up to the human body. And it doesn't mean that you should avoid these root vegetables. As I said earlier, if you have a healthy diet and there's no deficiency of iron, calcium, and also people are suggested to have a good amount of vitamin C, which can reduce the uptake of lead in the blood. And also, vegetables can take on the dust of soil with lead. How you're going to do with that? Actually, a very simple way. Just wash the vegetables. You can rinse with tap water, soaking in water, soaking in vinegar, or soaking in a commercial vegetable wash solution. All of those methods have been tested and showed that all of them have been working efficiently. There are only slightly variations in with each of these methods, how they are effective in removing that, but basically all of them worked. So I'll stop here.
Thank you so much for that insight. And again, I wanted to go back to the previous lead testing that was done at the schools, at least by the environmental health team. And when you look at this image, I think the highest amount was less than 25 parts per million. So basically, what in the areas that we actually tested, it was similar to the control settings that you had on this slide, correct? Yeah.
Mm-hmm.
And now I realize that the city of Tustin recently put out a press release that they contracted with a provider to do further testing. So that's great. So for those communities that are still concerned, we can wait for those results to see, what the results show. But in the meanwhile, if there are any concerns at all, you can take precaution, but the good news, at least to date, that the results that we have to date have been reassuring. Now I'm going to go to Dr. Deli, because I know that we talked about asbestos and we talked about lead. There are some other detections in this, some of the air sampling results in the smoke, the initial smoke plumes. So I wanted to hear from Dr. Deli and his take and insights from after reviewing the results.
Thank you, Dr. CK, and thank you again for the audience and your participation. I know we want to get to your questions, so I will go straight to the point. The most relevant part of my research is for the last 20 years or so, I've studied combustion byproducts, things that come out of burning electronics, for example. And all of the metals that, and again, thank you to EPA and CTH and the city for providing updates on the data. Pretty much all the metals that were monitored, chromium, barium, thallium, arsenic, zinc, all of those things do come out of the burnt materials that I've studied, the ash, and they're released into the air in pretty large amounts. So you can think of a pile of mobile phones, for example, and you'll find all these things. In addition, you'd find the volatile organic chemicals, flame retardants, PFAS, all the nasty things. And the data that I saw on the slides tonight that you also show either 0 levels measured or very, very low levels. I noted zinc. You can find zinc on any roadside because it released from tires rubbing on roads, for example. So the data are reassuring that there is no longer ongoing contamination and risk to the population in the neighborhoods. I think the emphasis on asbestos and lead were warranted, but what I saw in all the other metals and the VOCs are, either background levels, which you would expect, aluminum, for example, or nothing that will be associated with the emissions from the burning wood building of the hangar. And I understand that people are anxious because when you see the soup of metals, you will get worried, particularly for children. The reason I understand those metals and organics were measured is because we know what is in the wood and what was in the building, and we have a second hangar to compare with. So it's not just to throw out a list of hazardous metals and organics, it's to really think about what could have been emitted. And the data now show that all of those concerns, they were warranted, but not something to worry about. And going forward, there are many, many opportunities to continue to look at the data, to talk to people who feel concerned about those risks. But I want to make sure that we put the numbers in context, and when the methods, maybe we have time to talk a little bit about the methods for measuring asbestos and lead and some of these organics. These are very standardized methods. It's hard to get them wrong. And all of the agencies that have looked at the data and the methods, if they're there, they will find these chemicals. Thank you.
Thank you. So maybe we should go to that. I know that there were different groups and different people in the community that did testing. I know from the county and city standpoint with the contractors that were utilized, there were specific standards utilized to test the air for asbestos or to do other testing. And it's just really important if you did contract with a provider that you really, ask more questions about how they're performing the tests that they're performing and to do air testing. Dr. Coleman, is there a possibility for you to at least provide basic tips if people did already contract with a consultant, what to ask for?
Yeah, sure, Dr. CK. So if you are looking to contract someone to evaluate asbestos, things to consider is these surface asbestos contamination investigations really should be carried out by a qualified California certified asbestos consultant. It's abbreviated CAC. Preferably, they should also be a certified industrial hygienist. Take into consideration their experience. If they've got a work plan for the testing they're going to do, evaluate that. Look for their proof of training and their compliance record. But really, if testing is performed, the standard method to evaluate the presence of asbestos is something called transmission electron microscopy, or abbreviated TEM. This really must be used to confirm the presence of asbestos fibers versus non-asbestos fibers. It's important when a CAC is doing an evaluation, as was talked about by the other panelists on this webinar. A lot of buildings built before the 1980s likely contain asbestos or could potentially contain asbestos. So it's important that the CAC doing an evaluation should determine whether there's existing asbestos in the building and whether those materials may have contributed to surface contamination. It's also important to consider conflict of interest. If there is a CAC assessing asbestos surface impacts, they should not be affiliated with the firm conducting the repairs or removal. And really, you should opt for separate firms so there's no conflict of interest there.
Thank you so much. So next we'll move on to the current recommendations. And again, there was a press release submitted by the city of Tustin, and they're going to get more testing done in the communities to help reassure the communities and find out more. So we'll hear more from the city of Tustin as well as their contracted provider. Next slide. So current recommendations as they stand is, one, stay informed. There's a lot of updated information that's provided on the city of Tustin's website. Also, if you still have debris in your area that was potentially related to the hangar incident, please call 714-426-2444. If you don't remember that, just go to Tustin's website. They also still have a debris reporting form. So please put that in the debris reporting form and someone will get to you to remove that debris. And then basic health and safety tips. I know there's been many questions that came about. Is it safe to open my windows? Is it safe to go back to the landscaping activity? If you still have visible debris that is suspected to be from the hangar incident, it's still expected that you, one, avoid touching the suspected debris, avoid landscaping activity because you don't want to disrupt if that does have asbestos, and follow any guidance that's provided by a certified asbestos consultant. However, if you don't have any more visible debris, you're in a community where they did a primary and secondary survey where people in white suits came out and removed the debris from your backyards or your side yards, technically, as long as they've been through there twice, then technically you can open your windows and doors. If you want to take further precaution, you can use cleaning methods, such as a wet cleaning method, to wipe down windowsills or window screens or balconies or door entrances for any remaining dust that may be there. But don't use a pressure washer. And this would help address, the bigger concerns, which was asbestos and lead. And then use a high efficiency particulate air vacuum or a HEPA vacuum when you're vacuuming up the spaces, whether indoors or outdoors. In terms of the heating, ventilation, air conditioning units or HVAC units and air purifiers, it's a good idea after any type of fire event like this to replace your filter. And you have to look at your manufacturer's instructions and follow their instructions in terms of utilizing the appropriate filter. Not all filters can use a very high level MERV 13 type of filter. So again, look back at your manufacturer's instructions to replace the filter. And then if you are using an in-home purifier, opt for models that have a HEPA filter and replace the filter. But at this point, what we're seeing, at least from all the different results that we did see, is that it should be safe for you to turn back on your HVAC systems. I know that parks and public areas and were originally closed for a temporary period of time, as you know, a lot of different cleanup crews were going around to pick up the visible debris and wipe down the surfaces. At this time, as long as those parks and public areas have been reopened, you can utilize those areas without restriction, and pet owners can walk their pets again. Now, I realize that there is more testing happening, and so for those residents who are still concerned and want to take extra precaution, feel free to take extra precaution until we have more results from the consultant contracted by the city of Tustin. And of course, if you have medical conditions, you have more questions, please talk to your provider. As a family physician, I know that, you know, when talking to parents, especially children, I know we talked about lead. Anyone under the age of 2, if there is concern about exposure to lead, it is actually part of the preventive screening to do a lead test if there was exposure. So you can ask that of your pediatrician or your primary care physician. And next slide. I think that's it. So now that I've reviewed all the current recommendations, I'd like to hear from all the different panelists. Do these recommendations still hold with everything that you've seen and what you've heard and all the questions that we're receiving from the different participants?
This is Dr. Frank. Yeah, I think the recommendations are just fine. If anybody's concerned about a medical condition from asbestos, at this point, there's no testing that can be done that would determine if anybody has developed any changes or will develop any changes. The first changes we see tend to be on X-ray, and the levels that we're talking about in terms of background or from what got out into the community from the fire would never, in my opinion, cause any changes on X-ray. But even if they did, it would take a minimum of 10 years, but more likely 20, 25 years before any changes show up. So the one thing that one might do, you know, next time one sees their physician or for the pediatricians that look after the kids in the community, just put a note in the record that you lived in the area when there was this fire, but I really don't think that there's going to be concern about disease occurring in the future. But it's not a bad thing to put that information in your medical records.
Thank you. And I also think that the recommendations are appropriate. There's something we call the precautionary principle, and I think those recommendations assure the community that the worst is over. But it takes time for people to let that soak in. And so if you're still concerned, as Dr. CK said, these are common hygiene practices that should be part of how we live lives anyway. But I also know that the Hangar site is being remediated, and there are probably going to be people who are concerned with that process. I'm really glad that monitoring will continue, and hopefully the helplines and questions lines and this video of this presentation and webinar will be available for people to consult in case they have questions. Thank you.
I also want to say that I agree with the recommendations. And I want to add for those planting people, growing vegetables, that they can put a layer of compost or mulch on top of the soil, which may dilute the lead concentration. And also in some studies, it showed that adding the mulch and compost may further reduce the lead absorbed by any plant. So thank you.
Great. And then one extra thing, if you are speaking to your primary care physician, you know, the information about reviewing all these different exposures is not common practice for primary care physicians. I'm one myself. It does take an extra degree in occupational science and health. So if you want to get more testing for other components, you may want to consider talking to your primary care physician first, and then consider being referred to an occupational clinician, as they may have more expertise in appropriately testing for whatever you're concerned for. Lastly, I want to move on to what's next. So the good news is that the city of Tustin has consulted with or has contracted with a consultant to perform more testing. So we can use a precautionary principle, and if you're in that immediate area, maybe take more precautions until we get the full results. And I know EPA, as well as my own team, have done further testing. So we'll wait to hear more. But in the meanwhile, for everyone else, especially if you're further away from the site, you can resume back to your normal activities, which hopefully is reassuring to you. And I know that there's still ongoing questions about what's next. So we know that the Navy is responsible and will continue to stabilize the material, and is actively seeking a contract to help with the remediation or removal of the debris from the site. Would like to introduce back Eileen Mananian from DTSC to help us understand further DTSC's role in the upcoming phases.
Sure, thank you, Dr. CK. So as you mentioned, the Navy is the responsible party for this parcel. The Department of Toxic Substances Control, along with our sister agency, the Water Board, the Santa Ana Regional Quality Control Board, has been the lead agency for reviewing and overseeing activities at the at MCAS Tustin, so the Marine Corps Air Station Tustin. And so we will be resuming, well, not that we ever stopped, but we'll be participating in the remedial efforts. So we will be reviewing and approving the work plan that is going to be provided to us prior to any work taking place. And our main focus is going to be to ensure that the debris is transported safely and appropriately, and that it's also disposed of in the appropriate manner, and is done in accordance with any of the regulatory procedures or relevant requirements for that transport. We'll continue to work with all the agencies that are involved now. We appreciate the collaboration. It's very helpful because everybody has their own expertise, and I think together we've made a good team. So we'll continue doing our part with the remedial efforts, and more to come.
Thank you. And for all the participants and everyone who is logged into the show, I want to thank you for listening over the last hour and 10 minutes. We do have an extra survey that will be sent to all who have registered, because we do want to hear back from you. Hopefully this was helpful, and will help us with future communications, because we do want to keep you in mind and answer the questions that you bring forward. And again, I'm hoping that we addressed most of the questions that came through. I can't address the future efforts in terms of what are the plans for the testing. We'll wait and see what the consultant and what the city come up with, as well as the Navy. So more to come, and wishing you all warmest wishes this holiday season. And thank you all for being here.